So this study on late-onset depression as a potential risk factor for Parkinson's disease comes from the recent interest or the interest in the field in the prodromal phase of Parkinson's disease. We know from case control studies that people with Parkinson's disease often have depression before the onset of recognizable motor symptoms, and that can predate the motor symptoms for many years. Clearly, depression is not uncommon in the general population, but it is clearly more common in those who later receive a diagnosis of Parkinson's disease. So in order to quantify the risk associated with depression when it starts after, we defined it after the age of 50, but later in life, we undertook an imaging study, clinical and imaging study, recruiting people with depression who had not had any depressive episodes when they were younger, because clearly the vast majority of people who develop depression do so for the first time when they are younger adults. And we recruited patients who had depression after the age of 50 and looked at the clinical, non-motor and motor features of Parkinson's disease in great detail, including the MDS-UPDRS and various other scales. And we undertook dopamine transporter imaging as well as MRI imaging and compared the findings to a control group. And we found that people who had developed a late onset depression not only had a higher rate, obviously, of depression and anxiety, but also a number of the non-motor features of Parkinson's disease that we see in the prodromal phase, such as REM sleep behavior disorder assessed by a questionnaire, which is clearly not as good as polysomnography, but also other non-motor and motor features assessed with the MDS-UPDRS and another screening questionnaire. And we also found that they had an increased rate of abnormal dopamine transporter imaging, as is seen in Parkinson's disease. We didn't see any findings, any changes on the MRI imaging, either volumetrically or otherwise, although we did not use any more sophisticated MRI techniques. But there was a clear signal that that there's a higher rate of people who have motor and non-motor features, albeit subtle, in the group of patients who have late onset depression. And that suggests that late onset depression clearly is one of the conditions that can be a prodrome of Parkinson's disease.